Hey fellow nurses, welcome back to my channel where we make nursing knowledge fun and accessible. I'm a fellow nurse and we are continuing our medication mystery series. This series is super helpful for your continued education and NCLEX preparation or just general learning purposes. Whether you are a student prepping for exam, a new grad getting oriented, or a seasoned pro looking for a refresher. Plus, it's a great way for me to revise and stay sharp too. Today, we are zooming in on a specific powerhouse in the penicillin family, which is Penicillin G. This is your detailed med card for Penicillin G, a clinically accurate guide tailored for nurses. We will cover its overview, administration, primary indications, key nursing considerations, side effects, and a clinical pearl. That's a gold for syphilis treatment. I'll keep it simple, easy to understand with real-world tips and NCLEX style insights. This video is about 10 minutes, so grab your coffee or notebook and let's dive in. First, the overview. Penicillin G is a parenteral formulation. That means it's given by injection, not by mouth. It's a gold standard for treating syphilis and serious streptococcal infections. As one of the original penicillins discovered way back, it still plays a vital role in modern infection disease management. Why? It provides high tissue concentration, perfect for deep infections, and it's ideal when oral meds aren't feasible, like in severe cases or patient who can swallow. For example, if your patient is unresponsive, maybe they're in coma or they have some conditions where they cannot take any feed through mouth, or they're on NG tube, so and they're suffering from syphilis or any infection, we usually give them Penicillin G, which is through IM or IV. So for nurses, this drug is key in hospitals for gram-positive cocci infections, especially Streptococcus. It's bactericidal, killing bacteria by messing with their cell walls, as I discussed before in penicillin medication videos. Just like other penicillins, but remember, resistance is rising, so always check culture. So I just want to explain one more thing here, what I mean by resistance and checking cultures. So bacteria are becoming less responsive to commonly used antibiotics. This means infections are harder to treat if the wrong antibiotic is chosen. A culture and sensitivity test identifies the exact bacteria causing the infection and shows which antibiotic the organism is sensitive or resistant to. So they do the lab test where they check what kind of infection bacteria it is, and they try different antibiotic formulas on those cultures to check which one is working. So because resistance pattern change, the antibiotics started before culture results may fail. Cultures help tailor therapy. By checking cultures, clinicians avoid giving ineffective antibiotic, reduce complications, and help slow down further resistance. Because bacteria are getting stronger and resisting more drugs, healthcare providers should always get cultures to ensure the right antibiotic is used. So if you're using wrong antibiotic, you're just wasting the patients and your time, because that antibiotic is not going to work. So we need to check which one is more effective to kill that bacteria. So now talking about administration, Penicillin G is available only as IM intramuscular or IV intravenous formulations. No oral options here. It's unstable in stomach acid, so it breaks down before it can work. This means patient might need clinic visits for hospital stays if they need more doses. So patient education plays huge role here. We always need to explain to patient that maybe you will need to come for after a few days, or after you need multiple shots after a few hours, depending on the infection. So it could be Q4, Q8, Q12, or like within few days, right? It depends on the infection. There are multiple forms that include aqueous for IV, Procaine or Benzathine for IM, and long-acting ones for syphilis. So I want to explain these different forms here. I'm just going to take a minute. So these form refers to the different formulation for Penicillin G, each used for different purposes. So aqueous Penicillin G, which is in IV form, it's given through IV, of course, and it is short acting form used for serious infection that need high blood level quickly. Procaine Penicillin G, which is in IV form given through intramuscularly, it's medium duration, used for some moderate infections. And Benzathine Penicillin G, which is also IM form, it's very long acting, stays in the body for a few weeks. The preferred treatment for syphilis, especially primary, secondary, or latent syphilis. In simple terms, there are different types of Penicillin G. The IV form work fast but doesn't last long. The IM forms, Procaine and Benzathine, last longer, and Benzathine is the one used for syphilis treatment because it stays in the body for a long time. So pro tip here, choose the right injection site for intramuscular injections. Ventrogluteal or dorsogluteal muscle are larger and deep muscles. They can hold thicker or painful medications like benzathine, penicillin. Using these sites reduce pain for patient because the muscle is bigger and less sensitive. Always aspirate after inserting the needle. Once the needle is in the muscle, gently pull back on the syringe plunger. If no blood appears, it is safe to inject. If blood is pulled back, it means you accidentally entered a blood vessel. You should remove the needle and try again. This is important because some IM medication should never enter the bloodstream directly. So you need to choose the bigger muscle to inject your IM injections. So now, why do we use Penicillin G? For which purpose? First, syphilis. As I mentioned before, Penicillin G is the first choice antibiotic for treating all stages of syphilis. This include neurosyphilis, when the infection affects the brain or nervous system, and pregnancy because it's safe and very effective. Second, serious streptococcal infections. There are infections caused by group A Streptococcus, which can be very dangerous, like endocarditis, which is infection of the heart valve, necrotizing fasciitis, flesh-eating bacteria infection, and toxic shock syndrome. Third is endocarditis prophylaxis. For patients at high risk of heart infections, penicillin can be given before certain procedures like dental work to prevent this infection. Severe skin and soft tissue infections like cellulitis, deep skin infection, abscesses caused by bacteria that are sensitive to penicillin. Meningitis, Penicillin G can treat meningitis because by pneumococcus or meningococcus, because in high doses it can reach the cerebrospinal fluid, CSF, and fight the bacteria in the brain and spinal cord. So in short, Penicillin G is go-to antibiotic for some very serious bacterial infections, including syphilis, severe strep infection, certain skin infection, some type of meningitis. And there are some other infections that penicillin G can treat, which is pneumonia if caused by bacteria sensitive to penicillin, strep throat, especially severe cases, diphtheria, rare but penicillin works, gonorrhea can be used but resistant is a concern. So always do the cultures. Real world example, late stage syphilis treated with Benzathine Penicillin G IM once weekly for 3 weeks. This is a standard regime that they use for late stage syphilis. And for NCLEX, there's a tip related to this. If a question asks for the gold standard treatment for syphilis, the answer is your penicillin G. Penicillin G is versatile but still considered the most effective treatment for syphilis, especially important for exam and real life scenarios. There are some nursing consideration for safe care. For IM injections, it can be painful. Use Z-track method to inject and rotate sites. Electrolytes, some Pen G formulations have sodium and potassium salts in it, so always monitor in heart and kidney patients to avoid hyperkalemia or fluid overload. Always monitor for allergies. Ask them to stay 30-minute post-dose. Watch for rash, wheezing, hypotension. Have your epi and Benadryl ready. Deep IM administration. Use large muscle mass to prevent abscesses. For IV administration, check the med compatibility because Pen G don't like to get mixed with any other meds, and infuse slowly, like over 30 to 60 minutes. The other thing that we have to keep in mind is adjust dose in renal impairment. Get baseline labs, culture, CBC, renal function, and educate patient for follow-up and signs of worsening infection. There are some side effects as well. Every meds come with its own side effects. So skin rash is one of the side effects. Fever, after drug, anaphylaxis, which is life-threatening. We always need to monitor for vitals closely after first dose. Injection site reaction can be painful. We can see swelling, abscesses. Manage with ice and massage. And GI upset, of course, nausea, diarrhea, super infections like C. diff or yeast. Rarely some people have seizures in high doses, so always educate your patients. Emphasize when to call immediately when they see rash, breathing trouble, but normalize mild injection pain. It's very common. So that's our deep dive into penicillin G. If this boosted your knowledge, like, subscribe, and comment your top takeaway. Maybe a syphilis case you have seen before. Check the description for more information. Next in the series, more antibiotics. Stay safe and sharp, nurses. You're amazing. See you soon.